So in Florida, like all over the country, people come to the ER with a problem, and the ER doctors don't quite know what they're going to get when you walk in the door. And oftentimes it's a stroke, and the doctors don't realize that you've actually got signs and symptoms of a stroke. Or you've got abdominal pain or upper abdominal pain, but it's really a heart attack that's evolving. We see those kinds of cases perhaps more than any other cases, where the doctors don't appreciate the urgency of the problem, or there's a nurse who's involved and the doctor isn't contacted, or now we see more than ever mid-level providers. Those are the in-between providers, not quite a doctor, but more than a nurse, who take on more responsibility and aren't able to order the right test and make the right diagnosis. In the emergency room, doctors take all comers, and sometimes folks come in with a fracture. Sometimes it's a complicated fracture. Sometimes it's a patient that has a small problem and they decide to do a procedure in the emergency room. Well, emergency rooms really aren't equipped for major procedures, but sometimes ER doctors don't call in specialists. They don't have the right doctors come in, and they go above and beyond what they should be doing in the capacity of an emergency room. Under those circumstances, procedures that shouldn't be done in the ER are done, and oftentimes done incorrectly. In an emergency room, patients come in and oftentimes require urgent care. The problem is ERs are busy. And how quickly are the doctors going to be able to order the tests, have the CT scans done, have the blood tests ordered, where important results are going to help drive treatment decisions? When that isn't done timely, treatment gets delayed. And when patients have urgent medical problems, delayed treatment can oftentimes result in horrible outcomes. ERs have a responsibility to treat patients, and oftentimes that is with medications. And they have a responsibility either on their own or to call the pharmacy to make sure that the right medications are ordered and the right dosages are given. But again, busy ERs can oftentimes result in careless mistakes. Are you giving the right medicine? Have you double-checked the medicine? Have you given the right dosage? How are you giving an adult dosage to a child? Those types of medication errors can often have dire consequences to patients. We see in our cases handled in Florida many different cases where patients come into the emergency room and are sent home. Now, sometimes those patients need to go home. They don't have a serious medical problem. They've had an urgent need, it's treated, and follow-up care is appropriate in the office. But sometimes the patients need more care. They need more testing. They need a specialist to come into the emergency room to evaluate them before they're cleared to go home, or they need to be admitted. But the ER doctors have a responsibility. And whether it's an ER doctor or a mid-level provider like a physician assistant or a nurse practitioner, they need to figure out what's wrong, and patients that need to be admitted need to be admitted. But when those patients are instead sent home, and patients have horrible outcomes at home because they really needed continued care, that's where we can step in and help those families get answers and get justice.